Bentley Graves. I'm the Director of Healthcare and Transportation Policy here at the Minnesota Chamber. And it was a big week at the Capitol. First and foremost, it was Business Day at the Capitol on Wednesday. We had nearly 700 business leaders from across the state up at the Capitol talking to their legislators about business priorities for the 2017 session, like uniform state labor standards, tax relief, and transportation. So a big thanks to all who were able to come out. It was a great day. I think we carried a lot of water for a lot of important business issues, so thank you so much for making the time in your schedule to do it. This week was also the first deadline week, and that means that the bills that were introduced in either the House or the Senate had to make their way all the way through the committee process in either the House or Senate. Now next week is the second committee deadline, so any House bill that made it through its committees this week in the House has to make it through all the committees in the Senate by the end of next week, otherwise the bills are dead. So this is an important kind of funnel process in the legislative session, and it helps us start to kind of figure out what bills are moving and what bills aren't. You'll have a legislative update from our lobby team on Monday that'll kind of help give you some sense of where our priorities are at. I think all of our priorities are moving along well. And within that, I wanted to touch on a couple issues with related to transportation and healthcare. First, on transportation, as you all know, we've been working hard to make sure that Minnesota comes into compliance with the federal Real ID law so that Minnesotans can use their driver's licenses starting in 2018 to get on airplanes. Already, you can't use your Minnesota license to get into federal buildings and other federally secure sites. So this has been a real problem for businesses so far. It will become even more of a problem both for business and for Minnesotans come January 2018 if we can't use our licenses to get on planes. So the bill has made its way all the way through the House. This last week, it was up for a vote in the Senate on the Senate floor on Monday. Unfortunately, it failed. A handful of Senate Republicans voted against it because of privacy concerns and states' rights concerns, and they were joined by all Democrats in voting against it because of disagreements about whether or not this bill should provide driver's licenses for undocumented immigrants. And this really underscores the difficulty of getting things passed in the Senate. The Senate Republicans have a one-vote majority, and so I suspect we'll see more of this as the session plays out. Now, fortunately, there was some agreement to kind of revive the Real ID in the Senate, the Real ID bill in the Senate on Wednesday. The Senate voted to what we call reconsider it. So it's back before the Senate. I think they'll wait to bring it back up for another vote until the Senate and Republican, the Senate DFL and Republican leadership has an opportunity to get together and figure out what a compromise path forward is. So we're certainly still working on that. We appreciate all the support we got from our local chambers and our members calling their legislators in advance of these votes to help stress the importance of getting this done. And we'll certainly keep you posted as this continues to play out in the Senate. On the healthcare front, since the legislature passed Senate File 1, which is a bill to provide a 25% rebate to all those folks in the individual market for 2017, the work has moved on to try and set up a reinsurance program to help stabilize the individual market over the long term. So a reinsurance bill has now passed out of all the committees in the Senate and of all the committees in the House. We expect House and Senate votes on their respective floors on these bills next week. This is also a bill that we've been very engaged in. Most folks don't necessarily think that the business community has much interest in the individual market, but as a reminder, this is where folks that are self-employed go for insurance, and it's also where increasingly a lot of small employees have turned with their employees for insurance as they haven't been able to keep up with rate increases in the group market. So we have a real interest in seeing a reinsurance bill passed to hopefully stabilize the individual market for 2018. And we're going to be watching those bills closely as they come to the Senate and House floors next week.